Hello and welcome to our very first episode of Live and On Call at Lake Charles Memorial. I just want to take a second and introduce myself. My name is Allie and I will be your host. Just because this is a new format and a new thing that we're doing at Memorial, I just want to tell you a little bit about Live and On Call. This is an opportunity for you to learn from medical professionals in the area and have a chance to ask questions about topics that really concern you and concern your loved ones. So during this time, if questions come up or thoughts come up, feel free to drop them in the comment section below. We'll be monitoring that the entire time, and you'll have time to, at the end of our discussion with our physician today, we will have time to ask those questions and just get a professional opinion as well. So don't be afraid to ask questions. Trust me, I will be asking tons of questions. This is an opportunity to learn. That's what we're all here for. So today, our guest is Dr. Jon Gray. He's the Emergency Medical Director here at Lake Charles Memorial, and he's going to be discussing signs and symptoms of strokes, as well as risk factors and treatments, and all things that you can think of that have to do with stroke and stroke prevention. So I've just recently learned that there was there's about 800,000 people in each year suffering from strokes, and recognizing those signs and symptoms. I'm so sorry, my phone is ringing. Recognizing those signs and symptoms can lead to a better prognosis, as well as possibly save your life. So Dr. Gray, why don't you take a second to introduce yourself? I'm going to pull him up right here.
Hey, Allie, thanks. Thanks for having me today. Like Allie said, I'm the medical director at Lake Charles Memorial ER, and I'm also the medical director for our stroke program at Lake Charles Memorial. Allie, did we lose you? Well, I'll go ahead and just start talking about some of the stroke ideas or topics that we're going to be discussing today. You know, she did say that there were about 800,000 new cases of stroke every year in the U.S., and that is true. So about every minute, there's a new stroke patient within the U.S., and about every 3.5 minutes, one of those patients will die. So that's about 440 deaths in the U.S. each year just from stroke alone. So about 8% of those stroke patients will die within the first 30 days, and probably another 20% will die within the first 3 months. So that's why early recognition is very important for stroke symptoms. Let me just see what kind of questions Allie had for me. So the types of stroke patients that we see are typically going to be older than 65 years of age. That's where about 70% of all the stroke patients happen as far as the age range. And the risk factors that go along with what causes strokes are hypertension, diabetes, smoking, obviously, high cholesterol. And younger patients that have strokes typically will be the ones who have sickle cell anemia, or the ones who are on birth control or some kind of hormonal replacement, and also smoke in addition to being on those medications. Mostly we're going to see African American and the Hispanic populations at higher risk than Caucasians. And some of the the signs and symptoms of stroke, there's a mnemonic that we've created, and it's called BFAST, and that's what our code BFAST in the hospital we use. And it's an acronym that stands for balance and eyes, and that's for the BE. And the FAST part is for any changes in your face, arms, speech, and then lastly, the T is for timing. It's very important that we know when the onset of symptoms actually were for the patient who's experiencing a stroke. Many patients who come in with heart attack or heart attack symptoms, I should say, most people come in within 3 hours of the onset of symptoms. However, for stroke, people don't really recognize the symptoms quite as often, and so they oftentimes will show up at the 7-hour mark, and that's just an average across the U.S. Our treatment options diminish rapidly after the 3.5 to 4 hour mark, so getting to the emergency department very quick after your onset of symptoms is of key importance. Allie, do you have any questions I can answer at this point?
Yeah, so can you just tell us a little bit about the patients? I know you talked about some of those higher risk factors, but some of the patients that you see in the ER, would you say they're, how many people do you see regularly come in with stroke symptoms?
Yeah, it varies. Some weeks we may see 1 or 2, and other weeks we may see 8 or 10. It just really depends. Part of this, live on call was to bring more awareness to the community, because we find that most people who show up didn't even realize that they were having a stroke. And so just really being cognizant of what the stroke symptoms are and getting there to us in a very quick, timely manner is of key importance. And most people think, oh, I just can't use my right hand. It just may have fallen asleep. But if you're a piano player or a mechanic and that loss of your right hand function, you may still be able to move it, but if you don't have the dexterity and the fine motor skills that you really need to play the piano or to work on an automobile, that's where the true disability comes into play, that you've lost function of something that you use every single day.
Right. So, what does this look like? You mentioned the right arm and things like motor skills, that kind of thing. What are some other external factors or some external signs that a stroke may be happening or have happened?
Yeah, so that goes back to the acronym of BFAST. So obviously, if there's any changes in your balance, just suddenly, any changes in the eyes, so you lose vision in one eye perhaps, and then the fast part, which is face. So maybe you don't smile equally and one face is drooping. Arms is, loss of use of your arm or your leg. Speech is what the S stands for. So if you're having slurred speech or unable to say words that you're trying to say and they just don't come out. And then again, T is for time. We really need to know exactly to the minute what time your symptoms started.
Because I'm assuming that as time goes on, that recovery becomes more difficult. Is that why the timeline is
millions of brain cells lost each minute that time goes on, where there's a loss of blood flow to the brain. And so that's
a great lead into the next question. What is happening internally?
So there's a couple of different scenarios. The most common, it's about 85% of the time, and that's where you have an obstruction within the blood vessel itself. So I kind of tell people it's like a rusty pipe. A piece of the rust breaks off and it travels distally and it occludes the blood vessel. In that same situation, the place that the rust broke off, your body's natural response is to throw a bunch of platelets, which are aggregates in your blood cells or blood, that makes your blood clot. And it's trying to do that because it's sensing there's some internal bleeding within the blood vessel. And then so the part where the rust broke off, for instance, that too often becomes occluded and that's where our therapy actually comes into play, which I'll talk about in a minute. The other scenario, which is about only 15% of the time, is where a blood vessel actually ruptures and bursts inside the brain. Those are usually from hypertensive emergencies where someone's blood pressure is, 260 over 160. And the treatment options there are very limited as well, because the two are treated very differently.
Gotcha. So that means that there's two different types of strokes. Are they categorized by severity? Is there any kind of
they can both be severe, and they both can be minor. It really just depends on which blood vessel and the location in the brain depends on what kind of symptoms you have. Obviously, if the blood vessel is very large, it's going to affect a larger part of the brain. So you'll have much more severe symptoms as opposed to a very small blood vessel at the very end of its path, for instance.
Gotcha. All right. So just a quick reminder, everybody who's watching, if there's at any point during this discussion, you have a question that you'd like to ask Dr. Gray, please go ahead and put them in the comments below. We'll be monitoring that and getting that towards the end of our discussion. But Dr. Gray, what are some consequences of ignoring these signs, even if in a mild stroke? What are some of those, best case and worst case scenarios?
Right. So again, it depends on time. Time is really of essence. The quicker you get there, the more treatment options we have. If time goes beyond the 3.5 to 4 hour mark, it's really difficult for us to give us a medication called TPA, which actually breaks up that blood clot I was just describing that is formed when a piece of that rust breaks off inside the pipe. So those treatment options really become limited after that time frame. There are a subset of patients, if they have certain criteria, they may actually be a candidate for what's called a thrombectomy. And a thrombectomy is where the specialist will feed a catheter up inside the blood vessel within the brain and actually try to retrieve and pull the clot out. That can be done up to the 24-hour mark. But again, the longer the time goes without having a certain treatment, the more permanent or likelihood that you're going to have permanent disability from your stroke.
So what are some of those permanent disabilities or long-term effects that someone could potentially suffer with?
It can be a combination of all kinds of things. Loss of use of one half of your body. So you may lose, significant amount of motor function from your arm and your leg, leaving you, with the inability to walk or to use your hand. Also, just face symmetry and speech. You may have, lifetime slurred speech and inability to speak. Swallowing also goes along with that as well. So you may not be able to swallow without risk of aspirating foods every time you eat. So it can be very debilitating. But again, your symptoms could be very minor. It really just depends on where out in the blood vessel is affected during the stroke.
So I'm hearing all of this and I'm thinking, what can I do to prevent having a stroke in the future? Is this a hereditary thing that I need to be worried about if my grandmother's had a stroke? Do I worry about that in my family, or is it like healthy lifestyle? I mean, what did you say to that?
Yeah, so some things you just cannot change. You can't change your gene pattern. So if your family has a high incidence of diabetes and hypertension and hyperlipidemia, which is cholesterol issues, those are things you cannot change. The things that you can change are healthy eating habits, regular exercising. If you do have any of those medical conditions, making sure that you're very compliant with taking those medications to keep those conditions under the best control possible. Smoking is something else that goes along as a risk factor. Limiting alcohol use is also something else that needs to happen as well. So some things you can change and some things you can't. And certainly you have the ability to change the ones that you can. So it's, obviously compliance with your medications and just trying to lead a healthy lifestyle through diet and exercise.
Gotcha. So is there anything else, before we get to the questions in the comments, is there anything else that you'd want us to take away, or any last words about strokes?
Yeah, sure. I think the thing to really take away is to recognize symptoms. And, BFAST is a great mnemonic, again, that stands for balance, eyes, face, arm, speech, and time. So if you can remember those mnemonics, anything that just doesn't appear to be normal for you, get to the emergency room as quick as possible, call 911. They are very good about alerting us so that we know stroke patients are coming in so that we can be prepared. So just knowing the signs and symptoms of stroke, and don't ignore it. Don't think that it's going to go away in 30 minutes. Don't think it's just your left arm fell asleep and it's going to be okay. Get to the emergency room quick. It's always better to be safe than sorry. So that's the point I'd like to really hammer home, is just to recognize the symptoms and get help as soon as possible.
Gotcha. I will definitely be thinking about that. And I know that, that's something I don't know much about and I haven't been taught much about. So even for loved ones, if I see, my parents, siblings, whoever that is, it's good for me to know that information, as well as the viewers to know if it's not even happening to us, but it's happening to someone we're with,
Absolutely.
How do I respond? And so that's definitely very helpful to recognize that. We do have a couple of questions here in the comments that I'd like to get to real fast. One question is, please explain to everyone why the African American and Hispanic population is at a higher risk.
I can't tell you statistically why. It's just something within the genetic makeup. There's a lot of different cultures that are at risk or for different diseases across the world. And this is not just for stroke, but this is for parasitic diseases. This is, all types of infectious diseases, as well as heart attack and stroke. So it's more just part of the genetic makeup that, we're just born with.
Another question coming from Jennifer is, what are the chances or percentage of an individual to have a second stroke after multiple strokes? I guess, after their first one, there's a high chance that they would continue to have stroke?
Absolutely. Yes. Usually within the first 3 to 4 years, there's a high chance of a reoccurrence. You can either extend your current stroke symptoms into worsening symptoms, or develop a completely new, different stroke altogether, which would involve a different blood vessel altogether. So your chances are very high within the next 3 or 4 years after having your initial stroke.
And just, a follow-up to that, is there a chance that a second stroke or a third stroke would be worse, or is it just kind of depend?
And yeah, I think that just is a variable that's unknown. If it's affecting the same blood vessel previously, you've already got deficits that was, happened from the first stroke. So obviously, if you extend those, that stroke from the previous one, so in other words, if you could somewhat move your left arm, the second stroke, if it affected the same blood vessel, you may not be able to move your left arm at all. So certainly that would be worse.
Right. Okay. If anybody else has any questions, go ahead and, just this last bit, we're wrapping up. And so if you have any more questions to ask, please go ahead and put them in the comments. There's not a dumb question. We are all here to learn. But I guess one personal question that I have, just to, on the tail end of that, is, what is the best thing for me? If I recognize a stroke situation, maybe I'm at a restaurant or I'm with friends, or what is the best thing for me to do as kind of a bystander?
The first thing is just, recognize the stroke and call 911. There's something that I will mention that's come up in a previous presentation that I've done in the past is people asked, should I take an aspirin? If you're having a heart attack or heart attack-like symptoms, the answer is always yes. If you're having a stroke, the answer is always no, because we don't know if you're one of the 15% people that's going to have a hemorrhagic stroke. And the last thing you want to do is make it worse by taking an aspirin on top of that. We never give aspirin in the emergency department until after we've done the CAT scan, so that we know that you're not having any hemorrhaging. So very important, two different scenarios. If you're having a heart attack, yes, take an aspirin. If you're having a stroke or suspect you're having a stroke, definitely do not take an aspirin before getting to the ER.
Good to know. Good to know. Well, Dr. Gray, I just want to thank you so much for visiting with us today. I think that this information is not just, important for us working in healthcare, but also, the general public, and people need to know this information so that that they don't have to come see you in the emergency room.
Absolutely. Hopefully we've made a difference, and hopefully we've taught at least somebody to recognize the symptoms and to show up sooner rather than later. So your treatment options are much greater.
Yeah. So I have one last question for you. A lot of right now, especially in the middle of a pandemic, healthcare workers are the modern day heroes. And so I just had a question for you. What is, if you had a superpower as a superhero, something that would be beneficial in your line of work, what would that power be?
Gosh, I don't know. I guess maybe to have some X-ray vision, just so I could, look at people as soon as they walk in the door and know exactly what kind of stroke they were having, if they were having a stroke.
It would save some time, definitely.
Yes.
All right. Well, thank you, Dr. Gray, and we appreciate all that you do for Lake Charles Memorial and for our community. So thank you.
Absolutely. Thanks for having me.
Take care.
Okay. Bye-bye.